Hello, everybody. Good afternoon. So, we discussed today, this has been like a really, for me, a long day. We heard a lot of new technologies. And I must say, we take all these technologies in order to help creating life. We are about improving IVF success in vitro fertilization. We do that by taking using AI, micro-robotics, and creating a machine to help couples to bring to life babies. I start by sharing my personal story. Well, me and my wife were looking to have our first baby born, and then it took us a long time. Very fast, we were moving forward to fertility treatments, and it took us years, like 4 years. We weren't able to conceive. And then I was looking for a solution. I was saying, oh my God, we really want that. And as an engineer working many years for the medical industry, I was looking for a solution. I read books, articles, I consulted people, and I heard about this new technology. And by doing that, when I just started the company in 2019, the number there was 1 in 8 people in 2019, according to World Health Organization, using fertility treatments in order to conceive. Today it's 1 to 6, which means that's a big issue. I was looking for a solution. We were using the solution that I'm going to share with you today, and that's what we're dealing with. So in 50 years, men sperm count dropped by over 50%, and 96% of the cells are abnormal. That leads to a significant drop in success rates, and more birth defects, and higher costs, and of course, emotional crisis. That's really maybe something that led me to find this solution. So when embryologists look for sperm to inject it into the oocyte, which happens in approximately 80% of procedure, a single sperm is injected into the oocyte. They're looking at the sample in that way. That's very simple. They can only monitor the motility, very hard to see morphology, and that's a big issue. So today, the procedure of looking for a single sperm cell to inject it into the oocyte require approximately 3 hours to a very expert embryologist to do that, and it's very limited, and only a few labs in the world can do that, and it costs a lot of money. The concept I thought about and brought 2 of my colleagues is to make everything autonomous. So we build a system. It makes the entire process extremely fast. It's fully automated. It's consistent. It's objective, of course. This is AI, taking into consideration enormous knowledge of embryologists worldwide, and makes it affordable to each and every couple globally. So this is a short movie presented first examine the sample, just preparing the sample in a normal way, and put some drops from the sample into a specific droplets. Then she puts it into the system, and the system selects the number of sperm need to be selected, and press start. That's it. And from now on, the system operates autonomously. First, by using a low magnification, scan the sample, looking for the sample size and so on and so forth, and then moving to the high magnification. Using the high magnification, we actually scan the sample and looking one by one the motility and morphology of each sample, and actually separate it from the sample into a dedicated droplet. We repeat the process again and again and again. Each of every sperm oocytes, and there's a baby. Huge opportunity, and I'll be more than happy to share with you any question if you might have.
So the follow-up question, just to give you a bit more time, because this is fascinating. What are you looking for now? At which stage are you in this enterprise?
So by now we raised over $10 million. Going into round A, what we'd like to, so we have a CE marked for today there are 2 systems available in Europe and in Israel. We are looking to implement them in the States and in Asia, looking for $8 to $10 million additional.
We'll need FDA approval?
Yeah. We already have a CE, and we have clinical results, and today we are going into the US.
Fantastic. Thank you, Gal, very much. George, please.
Hello. We're going to have a bit of a change of pace. About 2 years ago, I met by chance the 2 founders of Cognizyme at an event in Germany, at a trade show. And in the following months, I went around and checked the interest of this in my market, in Austria, in Germany. And 4 months later, I led a family and friend pre-seed investment round into the company, and I became a member of the management team. So my name is George Fry. I'm now the Chief Commercial Officer of Cognizyme. I'm also running the German subsidiary. So why was I so fascinated by this product? Because I was intrigued by the fact that I want to be part of leading the global digital revolution in allied health therapy. Why is this something that's a problem? Because allied health therapy is an area in healthcare which is dramatically behind every other area in digital transformation in healthcare. For various reasons, part of it is because the solutions which are out there are very fragmented. So we have created a really breakthrough solution, a very different way of thinking about this, a global all-in-one platform for allied health therapies, which means all therapists, all patients, a completely inclusive business model, and one process. So what does it mean in terms of the opportunity? You see here the millions of therapists which are out there. We are currently mainly focusing on speech-language therapists, occupational therapists, neuropsychologists, but the plan is to expand this into physio, dietitians, mental health. And if you think about what these people are actually dealing with, these are the kind of disorders like dementia, autism, mental health, so huge blockbuster conditions which we are actually treating. And that's why TAM, SAM, SOM is so impressive. So what do we actually do? We are a multilingual, multicultural digital platform. Therapists are our users, and the customers are actually the health and elderly care organizations. And the therapists are using our platform to do the interventions with the patients in various settings. We are doing the standard of care, but much improved. Now, when you're talking about health at the moment, you have to talk about health economy. We have several aspects of where we are actually helping, because basically the therapists love us, but we need to convince the people who have the budgets, and that's where health economy plays a big role. More productive settings, shorter preparation times, utilizing lower cost resources. These are all aspects of why we actually deliver on the health economy promise. Our business model is very simple. It's a purely license-based software as a service business model. We're getting into the organizations, into the health organizations, and then we're expanding, and we are doing the upsell as we go along. These are some of the numbers which you see here, which shows that we have a very strong product market fit, and we have very good momentum. So Israel is our home market. It's actually our sandbox. At the moment, we have about 40 to 50% of Israeli health and elderly care organizations using Cognizyme, including some of the elite of Israeli healthcare. But we have, in the last year, been able to make sure that we validate 3 Europe international markets, UK, Germany, DACH, and US. You see some of the numbers. We have very strong retention numbers. We have our costs under control. Our revenues are going nicely in the right direction. We are obviously funded by the Israeli Innovation Authority, etc. And the whole product market fit and the activities we're doing are really very, very successful. So just to show you some of the big kind of logos. You know, you have Shiba, we are just closing on a design partnership with them, Clalit. But also for Germany, it's important that you see that we are really having made some inroads into the German healthcare market. Asklepios, Vames, we've had some really powerful pilots in there, and we are in the advanced stages of contract. And then, of course, the US is the market where we're going next. We've started already some really impressive first pilots with some of the leading healthcare institutions, like Mass General, etc. So we are really on a good stage in terms of the momentum, and that's why we are now doing our seed round. So we are looking for 4 million. The majority of this is going to go into sales and marketing, mainly into the US, of course. But I haven't spoken about the product a lot, but obviously AI is going to be a big part. It already is a big part. It's going to be enhanced in the future. And we're going to expand to create more, so really to create this all-in-one platform for therapists. Thank you very much.
Thank you. Just a quick question. Yeah. The product. So can you talk again about the user interface between the patient, the therapist? How does it look?
So the therapist is basically using various settings. It could be one-to-one settings, could be teletherapy, could be group settings. We have all kinds of various ways of doing it.
All online, or like?
No, not online. No. Online and not online.
And not
so yeah, so we are really using it also in the clinics, in the practices, etc. And the therapists are using the platform. At the moment, most of them are using analog tools, like working like they worked 30 years ago. With us, they can really use the whole breadth of content, activities, processes, and expertise that we bring to the market.
Excellent. Thank you very much.
Thank you.
And last on the presentations, Yossi, bevakasha.
Thank you very much. My name is Yossi Azulai. I'm the CEO and co-founder of Absent Medical. And I understand that I'm the last startup that's standing between you and the launch, so I try to keep it briefly. We are an AI-driven company. We develop medical platform using the olfactory nerve to diagnose and treat different kind of clinical situations. And we are starting with sleep apnea. It starts, and why sleep apnea? Because it's starting from the necessity. From personal mission, my father asked me to find him a solution 10 years ago for his sleep apnea problem, and I've searched around and figured out that there's no contactless solution. There's no solution that doesn't involve any implants, surgery, or mask with a hose that's attached to your face during the night. So my father is not alone. As I have figured out, more than 1 billion patients around the world are suffering from sleep apnea. Sleep apnea is actually a neurological disorder when the breathing starts and stops repeatedly during night. Sleep apnea, besides of the noisy part of the snoring, can lead to serious, related to serious health issues such as type 2 diabetes, obesity, decline in cognitive functions, and many more. It can double up the risk of death among the elderly age population and shorten the lifespan between 12 to 15 years. And it's not only clinical, it's also cost very much. Untreated sleep apnea can raise up the annual cost of an individual by thousands of dollars. And it's also a burden on the economy. It stands up at the United States on $165 billion each year for the direct and indirect cost on sleep apnea. The current solutions are either implants, surgical, or the gold standard, as called today, the CPAP device, which is uncomfortable, noisy, and the most important, not involving the brain. The brain remains passive in this process. And why it's important? Because we are offering a totally new approach. Instead of forcing the body to adapt to external solutions, instead of pumping air into your lungs, we are offering a solution that actually encourages your brain to breathe again. We're going to the source of the problem. And we do that with only release of nice scents during the night. Nothing to wear, no hose, no mask, just breathe. And we're using the sniffing reflex. This sniffing reflex is a survival instinct that's embedded in our primal brain. And it alerts us if there's something rotten or is fire in the woods, so we can run off. So this sniffing reflex is happening every time when we are presented with a nice sense. And it's happening because the direct connection between the olfactory nerve and the primal brain. It's based on a discovery from the 20 years of research at the Weizmann Institute. And they discovered that we are smelling during our sleep, and this mechanism can help sleep apnea and improve your REM sleep. And it's so hardwired, it's even effective in diagnostic low consciousness patients. We conducted clinical trial with our device. We proved that even after 1 night of use, we can lower the severity of sleep apnea by 1 category or more. We published it at the Journal of Sleep Research. The device itself is comprised of the controller, which got NVIDIA CPU inside of it, and the AI that runs on it. We got a radar sensor, totally private sensing, remote sensing device, and the scent cartridge, which got 5 different scents. The AI rotates between the scents during the night, so it prevents the brain to get used to the scents, because if you release the same scents again and again, the brain gets used to it and stop reacting with the sniffing reflex. It's fitting seamlessly in your bed. It's got a huge market, tens of billions of dollars. We even managed to get into one of the reviews, the finance reviews of Yahoo Finance, marketing us as a leading company to revolutionize the sleep apnea market. We received the Israeli Ministry of Health approval, the Israeli FDA. We start up a manufacturing line in Israel, and we start our commercializing phase and selling. We managed to pitch in the CES, the last CES, we won in collaboration with the US AARP, the third age, the Medi-Tech pitch event. We got numerous patents approved around the world. And our business model is very simple. We can work B2B2C, B2B. We even started as a SaaS model in Israel, sleep as a service. You actually pay 200 euros and you get your free sleep entire night without any hose and mask, and you breathe normally. We established in 2018. We got the support of the Israeli Innovation Authority for 3 years in a row, accompanied by the Israeli Ministry of Health. And today we are concentrating in the CE approval and the FDA approval, so we can get outside and spread the good. So it's a device, but it's not just another device. It's offering a hope for a better sleep and a better health. Thank you.
Fantastic. Do you have already paying customers, and what is sort of the trajectory of actual sales?
Thank you for that. We actually do have customers. We are a company with working with sleep clinics and physicians who recommend on our device. This is our B2B model, and the customers are already paying, private customers from all over Israel, and we are anticipating hundreds of units in this year and thousands of them in the next year.
Thank you very, very much.